All right, in prescription health now, it is expected within the next 20 years that 20 to 60 million people will get atrial fibrillation, usually just called AFib. People with AFib have a 5 times increased risk of stroke compared to those without it. Now, there are some current treatments, but some of those options can damage other heart tissues and also have a long recovery. TV5's Colette Boyd has details about a new treatment that changes everything.
Croy Crowfoot has been working with furniture for over 40 years.
I don't like sitting in an office.
But one visit to the cardiologist changed everything.
We did the test, and he came back and told Kelly, hey, you're fine, and looked at me and said, Croy, you're an AFib.
Croy had no noticeable symptoms prior to his diagnosis, so his reaction...
What's AFib?
It's the most common heart condition in the world, and yet most people don't even know they have it.
If you get palpitations, it could be that you had too much caffeine. You're taking some medication that could do it. You had excessive alcohol.
For most people, treatment involves medications, then cardioversion therapy or cardiac ablation. After electric shocks didn't work for Croy for longer than 3 to 4 days, Dr. Sheikh recommended a new treatment called pulse field ablation.
I'm also otherwise known as the electrician. You're able to do this ablation without damaging the other tissues of the heart. So you're specifically cauterizing with this energy tissues around the atrium.
Radiofrequency and cryoablation both require the patient to stay overnight after the procedure, and the heart doesn't heal for 3 months. But for Croy, who had PFA, he went home the same day, and within a week, he was back to normal activities.
Next day, went back to work, and, besides not being able to lift much, I felt 100%.
And that made Dr. Sheikh and Croy both happy. I'm Colette Boyd, reporting.
Since pulse field ablation became available in the U.S. earlier last year, Dr. Sheikh has done more than 600 cases, and he wants patients to know that no 2 cases of AFib are the same, so the treatment really needs to be tailored to you by your doctor.